Welcome to the Choralosophy Podcast. I'm Chris Muntz. I'm the host of the show, and you are listening to episode 32, Resetting the Voice for the Choral Director. This is a time when a lot of us are feeling our voices are getting healthier because we're not using them. We are reducing the wear and tear. We might be feeling some of our range come back. I thought it was an interesting concept to consider, and I heard I saw other people on Facebook talking about this phenomenon going on where they are feeling their voices return to them. So I thought, what better way to address that current event than to talk to an expert, which is what I like to do on this show when I don't know exactly what it is that's going on. I want to bring on somebody who does. And so I found Lori Sonnenberg, who is a speech pathologist, and you'll discover later is a singer and soprano and all kinds of connections to our vocal music world, to talk a little bit about what's going on. And we're going to run the gamut in this conversation of general topics of vocal health and vocal anatomy that we might just need to know. But we'll also be talking about specifically what's going on right now with our change of routine of how we use our voice as music teachers, as choral directors. What are some possible pitfalls and what are some possible advantages of having recently changed dramatically how we use our instrument? So there will be some information on here that if you're listening to this episode during the pandemic, that you'll find very helpful, but also there will be lots of information on this episode that even if you don't get to it until things are, quote, back to normal later on, you'll also find it very interesting. We go into some vocal health, vocal anatomy. We even dive into some sacred cow myth busting related to choral directors and sometimes what we perpetrate as myths about how the voice works. We may or may not address the soft palate. We may or may not address things like altos and sopranos never being asked to use their chest voice in a choral setting, all kinds of these things that you hear a lot, and I wanted to get her take about, from a physiological standpoint, from a medical standpoint, of how that's working. So we run, like I said, this conversation is wide-ranging. I really enjoyed it. It was a lot of fun. I probably could have kept her going for another hour, getting a lot of information. So I think you're really going to find this episode interesting. Before we get that far, though, I'd like to shout out the sponsors of the show. Just make sure that you remember to be checking them out as you plan for next year, which we're all, of course, hoping is having our students back in the room. You're going to need to get sheet music. And so I'd like to remind you, as you plan for next year, to go on graphitepublishing.com. Check out their wide range of composers like Tim Takash, Jocelyn Hagen, Eric Barnum, Joshua Shank, many, many more. And they have an awesome search engine on there where you can get your sort based on your choir's needs and see a list of what they have to offer on the site that pops up. It's really slick. And of course, you can get a bunch of sheet music there and download immediately and print for your choirs, and then you can use the Choralosophy at checkout, the code, to get 10% off. While you're doing that, you search graphite, then you head over to ryanmain.com and also get an opportunity to use your code. Ryan's got some amazing new works out there that you really need to check out. In fact, very recently on the show, Ryan was a guest. You got a chance to hear about how his website came to be. Make sure you go check it out. His sales method is interesting and unique in that once you buy from him, from one of his pieces, you own the PDF and you can print it as many times as you want. So if you find a favorite, you can sing it this year, you can sing it 4 years from now, you don't have to buy it again. So you're not paying per download or per print, you're paying once for a site license. You can check out and use Choralosophy there as well and save 10%. Last but not least, this is an opportunity to get kids going during online learning on SightReadingFactory.com. Sight Reading Factory has been my savior this last couple of weeks, keeping kids engaged and really actually seeing improvement every single week in the kids that are participating in these online exercises where they're submitting to me, and I'm hearing from day to day just improvement, which is really, really awesome. So if you don't have memberships yet, they are giving away memberships for free right now during the pandemic, but of course you're going to want to set up yourself for next year as well. So if you've got the budget to pay for those memberships, if you get to that point, and that's that part of the screen at Sight Reading Factory, don't forget to enter Choralosophy at checkout there. Okay, we're going to get to this interview next, this conversation with Lori Sonnenberg. I really hope you enjoy. Stick around to the end. if you can, or feel free to bounce around. It's a longer episode, but we get to all the good, juicy stuff about the choral myths in the last 20 minutes or 25 minutes or so of the episode, so make sure you stick around for that. Enjoy. All right, everybody. I'm here with Lori Sonnenberg, who is a speech pathologist and singing voice specialist. And I've asked her to come on the show because I had a thought that I noticed many of you on Facebook groups around the country are also having, which is that my voice has never felt healthier than it does right now when I cut loose in my house after a month of not teaching and sing things that are feeling really easy to me that didn't used to feel easy. And I wondered if you were feeling that too, and it seems like you are. So I thought Lori would be the perfect person to talk to about that phenomenon from a medical and functional standpoint, but also just to see if she's hearing about and seeing the same thing. So, Lori, welcome to the Choralosophy podcast.
Thank you, Chris. Thanks for having me. It's nice to be here.
I'm excited to talk about this. This is one of those types of topics that when you do a podcast about choir, and then all of a sudden the world breaks down and people aren't doing choir anymore, it becomes a little tricky to come up with content. So my first thought is like, yeah, well, and my first thought was I don't want to just do episodes all the time about online teaching because we're not super excited about that anyway. I know I'm not, and I would be more interested in talking about some practical aspects of the voice and how it works, and because we're going to need our voices again at some point. So that's kind of the reason I brought you on here today. I'm really excited to dig into it. But first, why don't you just tell us about you? Where do you come from? What's your background, and what got you to where you are now?
Okay, well, I like telling people that. Well, I'm from the South. I'm a Southern girl. I grew up in Northwest Louisiana and did all of my initial musical training. I was set to be a singer. You know, that was the goal that from a very young age. So I'm a pianist, vocalist, classical soprano, and I was in school for a really long time to be where I am today. I started out. I did a bachelor's and master's in vocal performance. My master's was also in pedagogy, which there back then there weren't a lot of programs like that. So I was in one of those early vocal pedagogy programs, and I think that that's when the tides really started turning for me professionally, where there was just this really strong interest in vocal health and vocal injury. Uh, and I just started consuming information about that. And at that time, there weren't, it was sort of a new idea for singing voice work to be a part of the therapeutic world, and so I just became consumed with that and incredibly interested in that. And I would say that a lot of my friends in like when I was in college, my first experiences with vocal injury and people that were experiencing that were my peers, my peers that were in school with me. But funny, it wasn't the voice performance majors, it was the music education majors who were preparing for these teaching careers and choral conducting careers. And so that was kind of my first personal experience with people that had injury. And I had these friends that were getting diagnosed with nodules and injuries, and they were really struggling in their studies. And so I just went full speed ahead in my interest in that, even through part of a doctorate in performance. It took a little while for me to give in to the specific training that was required to go that direction. And I've been interested from the beginning in being a singing voice specialist. And that really, I had plans early on to try to make a career of that without the speech pathology component.
Mm.
It's very difficult to do because you don't have the same level of credential and I guess, credibility in the
Right.
laryngology world. And so that was why I made that choice to continue with that study. So I put all that together. It took a really long time. My daughter always asks, like, how long were you in college, mommy? Because that doesn't sound like I don't want to go that long. How long were you there?
Right.
Yeah, it took a while, but I was just so fortunate, and I take some credit personally for putting all of that together the way that I did. But I also was really fortunate to have the right people take interest in me and give me those professional opportunities really early on. So, so I did work in a full service laryngology practice in the beginning of my speech pathology career, which started in 2005, I think, and I relocated to the Chicago area at that time. So I've been in suburban Chicago since 2005, and working with singers in the greater Chicagoland area and the region here. But I do have a private practice now. So,
Okay. That's awesome. That's very cool. So so the starting out as a singer, switching gears into the broader area of speech pathology, laryngology, and that kind of area, what it was, and I know you mentioned that that you were hoping to kind of craft a career that was singing specific. But did you feel like that was the goal? Like that's where your heart is to work with singers, and the other thing is just, I don't know, something like a necessary evil, or have you come to really enjoy both
oh my
aspects?
gosh. No, no, definitely not a necessary evil. I would just say that voice in general is where my heart is. I definitely feel like my skill set uh, as a singer, as a lifetime student of singing, a lifetime student of choral singing, and then becoming a voice teacher myself, and having such a long time where I functioned in that world, and getting those opportunities to learn how to tweak the voice and make those adjustments in a one-on-one, because I've almost always exclusively worked one-on-one. I have been a choral director of a children's choral program in a church here for the last 8 years, which was my first professional experience being a choral director. And I have very few skill sets and very little education in that. So I was really relying in that moment on my vocal skills and my musical skills to get me through that. But I think, the voice in general is just fascinating because it it takes a really specific skill set to make those adjustments, and you have to have this really interesting capability. What one of my mentors calls diagnostic introspection, like being able to listen to what you're hearing in the voice that's being presented to you and figure out, well, like, okay, well, what's going on in there? What are they doing that's contributing to that? And then you have to put that with the physical challenges if they do have injury or some sort of voice disorder on board. I will say that the singing aspect of it definitely is a strength of mine for sure, because I bring that skill set from the singing life and the singing world and teaching into the voice clinic
Okay.
and my voice therapy. I think any patient of mine, if you talked with them, they would say that even if they're not a singer, they're going to say, "Well, Lori's therapy approach is very singer-like." They're definitely going to give you that kind of feedback.
Right. What would you say is the proportion in your clientele for singers versus non-singers?
I would say that probably about 60% of my weekly caseload are singers of some sort, whether they are professional level singers, meaning, and not just classical genre. I mean, I get a little bit of all of it, from very elite level operatic performers to Elvis impersonators. I mean, I get it all.
Yeah.
Uh, and but probably 60%. And then a very large portion of that 60% have a very specific diagnosis called muscle tension dysphonia, where it very in a very specific way affects the way the vocal folds vibrate, the positioning, the posturing that they go to, where they don't close all the way. And I work locally with some doctors who are really keen on diagnosing that in the singing voice
Mm.
to a really detailed level, and they refer to me a lot for that type of work. So it's not uncommon for it's a daily thing for me to get a call that I've been diagnosed with MTD, is what we call that.
Hmm.
And so that has definitely sort of evolved as a subspecialty of mine.
Okay. So would you say they this is just interesting to me because you're the first person of your profession that I've had on the show, and I'm interested in this
Oh,
kind
wow,
of,
I'm honored.
yeah, broadly. But would you say that your caseload being mostly singers is because you are also a singer, so they come to you, or is it just that singers are fussier with our voices than other people are, and so we seek out that help more?
That is a great question. No, I think it's because that's my specialty, and there are local area laryngologists who know that, and they're familiar with my work. They know that they know how I work with that type of problem. And they are they're willing to send people to me to get that kind of work and those results. And so definitely it's because of that reputation, probably, that's just sort of evolved over time.
Okay, so you wouldn't say that the broader field of speech pathology uh, has has that much singer focus. It's just that that's what you're focused on.
That's a really great question in terms of like the prevalence of that. I'm not really sure. I haven't seen like data on that in a long time. There are some studies that kind of, like look into, uh, are singers more likely to go in to be seen?
Mhm.
You know, I actually think a lot of times singers delay being seen,
Ah,
because they're concerned or afraid to find out. I will say though that especially classical singers, um, classical singing is less forgiving and than other genres, sometimes with regard to vocal capabilities, and so there are many more like subtle nuances in classical singing that a singer has to be able to employ in the type of music, the dynamic range and the actual melodic range, and that that tends to break down sooner in a voice with injury than other things do, and so it's always going to show up in the singing voice before it shows up in the speaking voice. Usually, if it's a vibratory injury, meaning
right.
too much vibration with some sort of lesion on the edge of the vocal fold, and so I think that would be the reason that singers get help sooner than non-singers, because it actually, you have to have, I think, from my experience, you have to have pretty big uh, lesions or injury on the edge of the vocal fold for your speaking voice to get really hoarse.
Mm.
And so the I always tell in my lectures and things when I'm educating singers about this, it's like swelling and injury always affects the voice top down, and so almost always it's going to be top down, and so those highest notes go first.
Right.
But you, but
Yeah,
yeah,
so
so
it does seem so. Singers are fussy, and we notice, like, we notice when things are happening that other people wouldn't notice because they wouldn't care, and I think that's true of just getting a cold also. Like, we notice that first little tickle at the back of our
oh
throat.
yeah, oh yeah. There's definitely a hypersensitivity in singers for these kinds of things, and and that's not, I when I say, sometimes hyper anything sounds like a negative uh, term, but it's not. I don't mean it in a negative way. It's just that we're really in tune with what's going on in there. And so if you know that I have to always be able to sing this high G, and then one day the high G isn't there, well, that's a really big problem for a singer.
Right, absolutely. Let's zero the conversation in now. I think we've got kind of an idea of where you're coming from, but to zeroing in on the teacher, especially the teacher of singing. Do you find a lot of teachers of singing coming in with vocal fatigue just from the teaching aspect and not from the singing?
Oh, absolutely, hands down. That's a huge concern. Uh, when you think about people who are, I think a lot of my work about people who are at risk or at what we call like high risk for injury, or you'll hear me say swelling a lot. When I say the word swelling, we can be just talking about swelling that kind of comes and goes just from the average daily voice use, where you get a little swollen, the voice kind of, you can tell that something's kind of off, but then you rest and it goes away. And but then I also use the term swelling to refer sometimes to things that have been around a little bit longer, maybe more chronic. Chronic swelling is basically nodules, those kinds of dreaded words that people don't want to hear. Uh, but I think that the teacher is unquestionably at high risk, for because you want to think about, there are two things that kind of come into that. One is uh, the a person's innate desire to be vocal, and just how vocal and how talkative they are by nature.
Hmm.
So you've got that risk factor, right? And then you take all of the occupational circumstances, the opportunities that person has to use their voice on a daily basis, and not just opportunities but requirements. And so you take a teacher of singing or music educator or a choral director, and the reality is most choral directors are also music educators. So the demand just goes through the roof vocally.
Hmm. Yeah, I would imagine that's true. Okay, I'm going to interrupt our conversation just briefly to announce and make sure that you guys know that this show, one of its features is that we have a Patreon page. It's patreon.com/choralosophy, and that Patreon page is turning 1 year old in April. And so I'm doing something special today. I've not yet done this before, but I wanted to shout out 30 very special people right now who, over the course of the first year and a half or so of this show, have made it possible for me to do this program without having to drain my savings for the expenses of doing the show. It's been the Patreon page, actually, more so than the sponsors of the show, because, of course, as some of you know, the way podcast sponsorships work is I only get paid if you go and use those promo codes. Okay, so that is hit and miss with anything with choral music sales. Is you've got to be in that time of the year where you're programming, if you're going to buy something from Graphite, etc. So it's been the Patreon members that keep the lights on, and so I'm going to thank these special people, and of course invite you to join them as the next year of the show rolls around. If you feel compelled, and if you feel like you're able to throw in anywhere from $3 a month all the way up to $10 a month on the show to support what it is that we do here, that the mission of this show is to further a choral conversation and to recognize the work that goes into the show and make it a long-term sustainable model, something that I really hope you'll consider. So I want to thank these special people for jumping on and supporting this show in a very real way, and I'm just going to list them out, give them a shout out, so stick with me. Adam, Amy, Andrea, Andrew, Ariel, Brittany, Christopher, Cynthia T, Dev, Jason, and another Jason, Jim, Jocelyn, John David, John, Jonathan, Kristen, Lauren, Maurice, Michael, Michelle, Nathan, PJ, Riley, Ryan, another Ryan, Sarah, Shannon, and Sonia. I really, really appreciate all of your help, and it really does make a huge difference. Thank you so much. For the rest of you, if you're interested in joining that group, the Patreon's features are one episode per month that the regular audience does not get to hear, as well as advanced knowledge of what guests are coming on and the topics. And you're going to hear in a second some questions that came from the Patreon page. So you have the opportunity to ask the guests questions before they come on. I hope you'll join on over there at patreon.com/choralosophy. So, Lori, I've got a couple questions here from some members of my Patreon page. So first, from Nathan Connell asks, what symptoms warrant getting scoped for vocal damage? It's hard to discern what falls under expected vocal fatigue and what might be more serious damage. Any best practices you can recommend with the daily habits of a choir director in mind?
Yes, absolutely. That is a fantastic question and probably one of the most important in the life of monitoring your voice on a day to day basis. So we think about day to day variability. The most common symptoms, and I'm thinking along the lines of a singer. The singing teacher, the choral director, the music educator. There are some symptoms that really stand out for singers as some more common things that come up that may warrant a little further investigation. One is going to be loss of high, soft singing. So that's going to be at the top of the list. Loss of the ability to sing high and at a soft volume, because you have to remember that louder volume will cover up injury and difficulty. So high soft singing, onset delays are another really common symptom. Of course, chronic hoarseness that just doesn't go away. Even hoarseness that comes and goes. So if it's coming, it comes and it sticks around for a few days, but then it resolves, and then you don't notice it for a few days, but then it comes back. That kind of intermittent hoarseness that seems kind of cyclical. Another one is increased effort.
Mm-hmm.
So increased effort, reduced endurance, and day-to-day variability. That's a really that's not a symptom that people think about a lot, but that day-to-day variability, where some days it's really great and I can sing to the stratosphere and everything feels fantastic, but then I have these days where I can't get up there and I can't do it.
Right. So it sounds like the threshold in his question there, where all these symptoms might occur, if it happens one day and you're fine the next day for a while, it's probably fine. But when those things keep happening for weeks, that's when you go get
Right.
scoped. Right. Okay.
Right. And the other thing to think about from a healing perspective with regard to the outer layer of the vocal fold tissue is that what we want is for you to recover overnight. We want you to be able to wake up the next morning and be back to your baseline. But the reality is sometimes swelling takes a little while to set in. And so you might wake up the next morning and then that's when you notice all of the difficulty. So 1 to 2 day recovery, that is reasonable.
Mm-hmm.
That's reasonable. But a week-long recovery, several weeks, or where that multiple day recovery starts happening very regularly, that's a concern.
Got it. Okay. Next question is from Andrew Snyder. His question seems to be related to some speech impediments. And if we have those students in our classrooms, whether a private voice lesson or in a choir rehearsal, his question is related to frontal lisps with the S and the Z sound, as well as possible difficulties with rolling R's. So basically are there any tips that you have that we could use in a class?
Full disclosure, someone who's really struggling with that needs to see a speech pathologist to get help with it. But along the lines of what we can do as singing teachers and choral directors, it's all about tongue position, right? So when you're dealing with S and Z, specifically those fricatives, it's about the tongue position. And so almost always the tongue is coming too far forward, right? That's what we're talking about. So one of the things I like to work with is, and I use this exercise for a lot of things, but sipping through a straw. I actually happen to have one. I always have a straw nearby. So when you sip through a straw, whether you're drinking liquid or just breathing through it. So we call it pursed lip breathing or straw breathing. So the tip of your tongue gets pulled back when you do that action. So whether you're drinking liquid or sipping air through the straw, the tongue position gets pulled back a little bit. You can feel, and it actually kind of goes close to the position for S and D.
Oh,
So you can't. So an exercise that might be kind of interesting for the student would be to breathe through the straw and then exhale on an S. So and you try to get them to pay attention to not moving, not allowing the tongue to come forward again.
mm-hmm.
So because it's going to go back on the inhale, and then they try to keep the tongue in that same position. So that's an idea.
Right.
Let's see, what was the other sound? The rolled
The rolled
R.
R, yeah.
Boy, that's a tough one. I'm kind of the mind a lot of times with singers that they can either do that or they can't. I feel like it's kind of a, in terms of sustaining it, like that there's some kind of genetic disposition for that. I do believe. However, if you're just talking about flipping an R in language, so amore, when you want to flip that R, you can just use a dental D. You could cue them to say D.
Mm-hmm.
And I think that kind of takes care of it. It's not an exact match, but it works perfectly fine in the context of lyrical diction.
Yeah, you're talking about the difference of maybe a millimeter of tongue placement.
Oh, like so tiny. And
yeah.
No one's going to hear that and no one's going to notice.
Right. Yeah, absolutely. Well, thank you so much for answering those questions from the Patreon page, Lori. And I wonder if your thoughts about this. I don't know any science, but that's why you're here. I've heard several colleagues, female colleagues, talk about how they feel like it's worse on women choral directors than it is on male choral directors with the vocal fatigue from teaching. Would you say you've seen that, or is that just an anecdotal thing?
Well, I will say, if I think about my caseload, I definitely have a higher incidence of female teacher patients, in the singing world for sure. I'm not sure if that is exactly because it's harder on them in the classroom. I'm not sure why that would be. I'd have to think through that a little bit. One thing I think about is just that female vocal folds vibrate faster than male vocal folds do. And because our frequency is higher, we're singing higher pitches. I wonder if that, could have something to do with that. There also could be some just social dynamics in that, in the classroom with students. And student response, and I don't know. That's a really interesting question.
Well, the one reason that I hear usually is, of course, classroom management comes to the very root of all vocal fatigue problems from teachers. Is if we're speaking over our students, then that's going to create the problem, no matter if you're a man or a woman. But with men, this is what I've heard, and you see what you think about this, that we have the falsetto advantage in terms of demonstrating for our students. And a lot of times female teachers find themselves like they know they shouldn't, but they push their voice down into a pitch range that is not very healthy or for sustained work to try to demonstrate for their boys. Whereas when I try to demonstrate for my girls, there's a slightly less taxing mechanism that I get to use for that. What do you think about that?
Well, sure, because I think, we all know that for females' voices, that when we push them and feed the lower end of the voice. Now, I think about it two ways. We feed things and then they become a little more predominant. So when I think about the range and a singer's range being in shape, I think about that. Like we tend to uh, depending on who you're teaching in that circumstance, to feed that part of the voice. And I do have people that come in where they say, "Oh no," I'll say, "Can you think back in your story and your history? Like what changed? Did anything change during this period of time?" And occasionally I'll have people say, females say like, "Well, I'm working with my tenors and my male voices, and I find that I'm demonstrating a lot more down there, and I think it's really tiring." Uh,
Mhm.
so absolutely, because also I'm gonna just put a little comment in here that I want to challenge some of this, because I think that a lot of teachers, like in your position, aren't uh, sometimes are not being attentive to their own instrument, and I demonstrate in the very, very lowest part of my range on a daily basis for male patients that I work with, and I'm talking like really power driving of the voice and bass levels for me, uh, and and it does not cause harm or trouble for me. I don't have any issues with it, but that part of my voice is really in shape because I work on a daily basis to keep my entire accessible range conditioned. And so if you
Mhm.
don't keep that part of your range conditioned, but then you try to go down there and activate it and feed it, then it's not going to respond really well for you.
Now, could you explain a little bit about more about from a technical aspect what you mean by what you just said? And because I hear that a lot, and people talk about keeping the different parts of their range in shape, but physiologically, what is happening when your range is in shape versus when it's not?
Well, in speech pathology, in the speech pathology world, we think I don't think that in the choral world, in the singing world, the word function, vocal function, and vocal efficiency come into the conversation. It's not at the forefront of those thought processes a lot,
Mhm.
but from the speech pathology perspective, we're always working with people to get voices working efficiently. And what that means is that the three subsystems of voice production, the respiratory system, the vibratory system, which is the sound source itself, and then the resonatory system. So we've got breath, sound, and resonance. And
Mhm.
those three systems crave balance. They've got to be balanced. And so when I say a range being in shape and being well conditioned, I don't just mean that you use it. I mean that you are using it in a way that okay, if I do these sounds this way, these exercises, and sing this way or exercise this way vocally, I know that that's a really efficient way for me to do that. I get the very best product that I can for my voice personally when I do it that way. And so then when you are attentive to that in your own vocal work on a regular basis, your voice is not going to falter as much under those demands that you're putting it under from a
Right.
range perspective. A voice that is well that where it is efficiently operating, or another word we use is optimized vocal function. uh, it's going to withstand uh, the vocal load and the hoops that you're trying to put it through better.
Okay. So the in shape then might have a different connotation when a layperson hears that, and we might think about everything as a function of in shape means your muscles are worked out and stronger or whatever. But it sounds like you're describing in shape as a little bit closer to a technique that is consistent, so that every time you're accessing a certain part of your voice, you're doing it in a similar way to reduce the strain and the stress on the instrument with the balance of the different parts of your voice. And
Yeah, and absolutely. And then of course, like you're when you think about it from a muscular standpoint and an exercise physiology standpoint, absolutely. The Once you get that alignment in the vocal system and things are working really efficiently, uh, then you build, and it does get stronger and more resilient with repetition. Absolutely.
Mhm. Yeah. Okay. That makes a lot of sense. So in as this shutdown of schools and teachers started to happen, did you have any clients that maybe were have some teacher clients that had vocal problems going into this time off, and have they reported any kind of improvement in health?
Yeah, it's funny. The first few weeks, so I have been doing online treatment now for a month, a good month. And I had kind of made the decision even before our state, uh, shut down schools for those first couple of weeks. I had sort of made the decision I'm going to work from home anyway, and because singing, just vocal load and putting out sound, there's a lot coming out into the air. And I'm in a
Mm.
really small space with people, and we're face to face and really close. So I had already made that decision. I probably have, just on average in my weekly caseload, I'm seeing uh, 5 or 6 teachers, as a part of those appointments. And so I probably have that many regular teachers involved. And the first couple of weeks, they kind of disappeared because everybody was just sort of figuring things out, and they're trying to get their own setup going. But then I started hearing from them saying, "No, I actually do want to keep working. Let's do this. I've got more time. I'm more
Yeah.
available. So let's have an appointment." And so it was very noticeable. I have to determine in the first few minutes with someone when I'm meeting with them, do I hear a change from the last time that I was with them?
Mhm.
And I can, I have to know right away. And I have a few little things that I do to test that. And all of them across the board, no question. Injuries are down, they're smaller, they have more range available, their voices aren't feeling as tired, their stamina and endurance is better. And I had one in particular who, I mean, she probably had a total of 2 octaves return. Like, it was
Wow.
really remarkable.
Yeah. That's yeah, 2 that's not insignificant. Yikes.
Oh,
What about on the flip side of that question? Is there any danger in the fact that we're not using our voices on a daily basis getting out of shape? And is and what how would you describe the balance between those two? On one sense, we're resting and we're healing, but on the other side, if we're not going back to school till August or September, many of us, what are some dangers that might fall into if we're not careful?
yeah. Well, there are a couple of things that I'm noticing with people right now. One is that the online teaching, I'm just going to call it online teaching. There are a lot of different things we could say about it, but that uh, teachers are finding it fatiguing in a different way, that there are
Mm.
some challenges coming into that, and I personally am experiencing that. I'm actually having a lot more trouble vocally. I don't normally struggle, but I am right now because number one, I'm very distracted helping my child and all the dynamics that are going on inside the house, and I'm forgetting to warm up sometimes and not being as attentive to the things I normally do when I'm working in person with people. So I think that the online teaching is bringing its own challenges. Voices are getting fatigued in a different way because we're using a different manner of voice production. The acoustics aren't the same. A lot of people are wearing headphones and they aren't hearing themselves as well as they need to. There's just a lot. It depends on the person's setup. Um, but going back to your question about the exercise and being in shape versus the rest and the healing, and it's this kind of interesting cycle that people are being put into right now. When you're dealing with tired voices, injured voices, uh, and I just want to be clear here that the reality is, I think there are a lot of teachers and choral directors that have swelling and injury on some level that they're just not aware of. They're dealing with it on a day to day variable basis, and they aren't recognizing it for what it is.
Hmm.
Because a singer says, my voice is so fatigued. Well, what does that mean? Is does that mean that it's muscularly tired, or is there some swelling on the edge of the fold creating similar sensations and symptoms? So there are some questions about that. But when you think about the balance that you asked about, that's a really, that is a really tough thing for teachers to figure out. Is And anyone dealing with voice struggle is, well, how much do I rest and how much do I work? How much do
Hmm.
I exercise? And finding just the right balance. It's like the magic equation, like magic recipe. And that recipe is going to be different right now
Right.
because,
Absolutely.
right, there's less voice use happening, but the
Hmm.
voice use that is happening is very different than what they're used to.
Yeah.
Uh,
Well, I'll
right.
just jump. Yep. I was just going to jump in real quick and give an example, if that's okay. Um, I've noticed now the conversation might be different with choral directors than even private voice teachers, because for us choral directors, we're used to having to give instructions in front of large groups of kids, demonstrate for kids in all kinds of weird ways from that are not natural to our own voices, and we're doing this mental gymnastics all the time that can't be super healthy. And so and I would imagine most of us are probably healing from that part. But then I
Well,
noticed my wife is a full-time private voice teacher, and she's got 35 students, all of which are doing Zoom lessons right now. And she's telling me that she's vocally fatigued from
oh,
those Zoom lessons because she is now using her voice into the microphone in a way that she's not used to using it. And I've had a little bit of an advantage, like I was saying before when we were first signed on, is I've been doing these podcasts over a computer for a year and a half now, so I'm kind of used to what my voice sounds like through this microphone. And so my online lessons have been fine, and I'm used to it. And I thought that was an interesting point you made about just it's not even necessarily, and correct me if I'm wrong, of course, but it's not even necessarily that people teaching online are doing something so necessarily incorrectly. It's just that it's not the way they're used to using their voice.
no, it's different, and because the hearing is different. We're
Hmm.
hearing ourselves differently. We're hearing the other person differently, and our brains are just in overdrive, like trying to figure out, this different way to do it. Um, you know, One of the things that I think, well, I'll just tell you, like from my perspective, and I think about your wife. You mentioned your wife, and so I'm in a similar situation. So yesterday, for example, I taught 6 straight hours of online
Hmm.
therapy, and that I'm realizing that 1 hour of online teaching for me, or online therapy for me, really kind of equals more like 2 hours of in-person teaching
Yeah.
in terms of energy output and vocal output. So I am working with my administrator to just adjust my schedule, and I contacted her and I said, look, you know what, I can't do 6. I just can't. And so we're going to have to limit my, you know, I've got this many hours that I think my voice can handle, and that's what we need to do. And so
Right.
I think everybody, now teachers right now, I'm not sure that I understand what everyone's setup is. I'm gathering that everybody's a little different.
Hmm.
I'm hearing from some people like, I need to be available this many times a day for this period of time. And I'm actually interacting with students during that time. I don't know if they're singing. I don't know if they're talking. I don't know what they're doing.
Right. Right. Yeah, I would imagine that's widely varied, especially with all the different expectations. If it's a private studio like my wife's, she gets to kind of make all the rules of what goes on. But many of us are teaching for a public school or a private school, and they're going to have an online curriculum we have to deliver, and sometimes that's face to face over the computer. Sometimes it's all written work. Yeah, it's everybody's in a different boat for sure. But yeah, I think that sounds all like it would be a super helpful thought process for people to go through, especially the part you talked about of recognizing that your vocal use right now is different than it normally is and will require some rebalancing. And is there, would you say that there's any concern that we teachers, especially the choir teachers that use our voice in such weird ways, that we should have any concerns that could be addressed by creating some good habits during this downtime? That you, any advice you could give to us?
Absolutely. I think one of the perks of the reduced vocal demand and some of the improvements that people could be noticing, like, oh, my voice is not as tired. Um, I I guarantee you that people are having range restored that they've been missing for a while.
Hmm.
I know that's happening. And that's a really good sign. And what that means is that swelling is going down because there's less vibration. And so, my best advice, I think about two things in particular. One is take advantage of the opportunity to get to know this better baseline, because this is a
Oh,
better baseline for a lot of you. And what is that new baseline, that different baseline, like, compared to my normal baseline when I'm doing my normal teaching load? And if it's different, then that's pretty powerful. It's like, okay, this is my best baseline that's available to me. And you get to know that better, and you start to monitor that a little differently, and that way when your demands do increase again, you can kind of track against that. And 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 now the struggle is how, because here's what we don't want you to just be this way during less voice use and have this great voice available to you, and then come August or September and you go back to your teaching load, then it just goes away again.
right.
And so, that take advantage, I would say, also take advantage of uh, a little more time to work on your instrument with regular vocalizing, because I mean, I spoke recently at the Illinois Music Educators Conference in Peoria back in January, and I had this great morning with just a really great showing for this lecture that I did on being a busy choir director and how to survive that vocally, and a lot of the things that you and I are talking about. And I asked the question, uh, how many of you do your own personal warm up before you start the teaching day? And I asked people to be really honest, and out of like a couple of hundred people, like 10 people raised their hand.
Right.
And my question to people is, how can you expect the voice to do these things for you when you're not working it, when you're not,
Mhm.
giving it that opportunity? So the warm up, exploring better vocal function and capability right now, and getting to know that better baseline are probably two of the things that stand out to me just during this kind of unusual time for all of
Right.
us.
It's almost, yeah, it's almost like an opportunity, if we choose to look at it that way, to reset the voice and start the school year with a better, with a higher standard for what our voice should feel like. And
Absolutely.
yeah, I really liked the way you put it too, which was the, establishing a new baseline for what your kids, and that makes a lot of sense to me because a lot of times, if during a weird time of teaching where I'm starting to feel my voice become fatigued, it's actually, I've never thought of it that way until you put it that way, which is that I'm noticing that it's fatigued, but in comparison to what? In comparison to what I've become used to, and it could be that my what I'm used to is already fatigued, and now I'm just more fatigued than than I was
No,
before.
exactly. But here's the thing that it comes down to, and this is, I'm not sure that I fully understand. I would ask you, like, I want to understand the psyche and the decision making involved in the teacher and the choral director who does not listen to warning signals that the voice gives. Because here's the thing: the voice is always going to tell you. It's always going to tell you, and and but people don't listen to those signals. We don't listen to them, and then we just keep going because, well, I've got to keep going. Uh, but voice is finite. It's not,
Mhm.
it's not just this endless thing that is there, there's just not like endless amounts of it. Now your limit and my limit are different.
Right.
Everybody's got a different limit. And so that's why understanding your limit is so much more important. But right now, say you're paying attention to new baseline, you're kind of monitoring a little bit differently. Well, a lot of you probably have the opportunity to listen to that signal and do something about it, which usually just means I'm going to stop and I'm going to rest and I'm going to listen to that signal. Uh, the other thing, you said the word reset, which is one of my favorite words in working with teachers throughout a teaching schedule. And I know the schedule is different right now. It's really
Hmm.
different, and I can't imagine all the different scenarios that people are dealing with in their e-learning and distance learning. But finding and identifying a little reset button for yourself can be really, really helpful. And everybody's reset button is different. And what I mean by that, so my reset button is lip trills, like little. Some people love them, some people hate them, but lip trills are a beloved semi-occluded vocal tract exercise that just gets the job done for a lot of people, right? It lines things up, it gets the breath connected, the shaping is really good, the resonance is good. It's just a winner for a lot of people. So for me, that lip trill is my reset button. And what I mean by that is I finish a session. Uh, I get, maybe I get a 5 minute break. You know, we're lucky if we get a few minutes to do something, run to the bathroom, get a drink of water. But as a part of that break for me, I'm resetting with what I know is going to kind of align things and get me back on track for the next class or the next session.
Right.
And that can be a very powerful tool. Even during this, we're all at home, we're teaching online, like you need to be doing that. So you
Yeah.
reset it and then your voice is ready to go for the next. Now, it might not be perfect and it's not a perfect science, but it at least gives your voice the opportunity to kind of come out of the, I call it, get it out of the dungeon, kind of, wake it up and reinvigorate it for us for a minute.
Right. Yeah, I will speak briefly to the question you asked earlier, which was the psyche of the teacher that ignores the signals. And at the risk of sounding super nerdy, my audience is already used to that. But everybody does a risk analysis, whether they know it or not, every time they get out of their bed in the morning. Right? To we take the risk of stepping from the carpet floor onto the linoleum floor and the increased risk of slipping, but into our bathroom. But we do it because we know that we might have more risk of slipping, but we have to get clean because the risk of going to work stinky is worse than the risk. And that translates into our classrooms too. And we get into our classrooms and we don't realize we're doing it, but we're calculating the risk. We know when we use our voice a certain way, we're probably at an intellectual level causing some fatigue. But the risk of going on stage in public later with our sopranos sounding like screeching owls or whatever um, is higher because we might be shamed or whatever. And so we calculate and we know we're not doing necessarily what's best for us vocally, but the concert's next week and I've got to get this ready. And I'm going to take that risk and I'm going to do it. We just do it without thinking about it consciously. This is something we're constantly doing. And I would say everybody does that. But and this is actually going to my response is going to tie into my next question, because I think that it's part of that. That's part of the answer to your question, is that we know that what we're doing as teachers is not super healthy, but we do it anyway because we think we're going to get some payoff that's worth it later, right?
Right.
But I also think, especially in the choral world, because we are not all required to take any kind of vocal pedagogy when we go into the classroom. Most of our programs that train choral music educators don't have to take any kind of vocal pedagogy or vocal anatomy at all. And so, uh, my question then to you, and this is kind of an opportunity for some levity, I guess you could say, but are there any vocal anatomy slash vocal health myths that you come across that are your favorite to dispel?
Mm,
And it's okay.
okay.
You don't have to worry about hurting anyone's feelings. That's also part of the vibe.
um, wow. Okay, that's a great question. Um, I think that the first one that comes to mind. Now, I'm focusing on not vocal health myths, but that vocal anatomy and physiology and voice
Yeah,
function.
that's great.
Um, and I'm going to answer the question by explaining to you what I see coming to me.
Yeah.
Um, I would say that 8 out of 10 times, singers that come to me with uh, vocal struggles have been taught, and this is the singer patient who's struggling with tension patterns, whether there's injury on board or not. They do not know how to access healthy chest voice, and uh, they've been taught in their lessons and their training in the past that that head voice head voice production is the best, the primary. It's the way to go. It's the healthy way. And a lot of times that information is being passed on to their students too. And so I would say that controversy and that confusion about how chest and head voice function together from a registration standpoint is definitely a myth. And we're learning so much more, so much more today than we did about
Mhm.
how the voice works in terms of the registration piece. But I spend so much time helping people learn to access chest voice and healthy chest voice that we can mix into what they're doing to achieve good vocal fold closure and a better balanced instrument. And so I think that's probably the number one uh, myth. And I don't know if it's a myth. Maybe I'd have to ask you about that.
No, it
I,
is. I'm really glad that you mentioned it. I teach in a choir program in a high school that's old enough to where I still have some textbooks from the '60s, the '70s, like hard copy textbooks. Um, and one of them, even in the textbook, has printed that females in a choral setting should only ever sing in their head voice. And
right,
it doesn't matter what note it is, that it's just always your head voice, and they're taught to bring the head voice from the top all the way down to where you can no longer phonate. And I've always felt like that was a myth, but partly again because I took vocal ped, and you start to learn how the actual function is. But no, that's a really good one. I'm interested to hear some of your other ones, but it is still being taught, for sure. So you're right. Although I do, my feeling is that it's falling out of fashion. As you said, we're
yes,
learning more. We're learning more about how that. So now people are starting to understand. There is a way for singers to transition registers just like you would in your
right.
voice lesson
And the
in a
other
choir.
thing that's coming more to the forefront of voice training, just in general, is the concept of cross training, and that we can cross train styles and genres and techniques and in a singer's training, no matter what their primary genre is, and they can learn from that. I always say to my patients, like, one of my priorities, my singer patients, one of my priorities for them when they're done working with me is that they have so many options. I want them to have options. I want them to say, I can sing it like this because I can and because I choose to and because I want to. And then I can sing it like this because I know how to do that, and that they can learn to interchange from a technical standpoint, and that I think is that's part of developing a well balanced voice, I think. And I think that way for our kids too. When I hear it's really important to me that choral directors understand that, like, no, we're gonna get in here, and there are special uh, and efficient ways to work on closing those vocal folds and eliminating that breathiness that you don't want to hear in the tone. And there are ways to do that, that encourage good, healthy, mixed registration for these kids, because kids' voices can do anything. They
Hmm.
can make all these noises way easier than we can. And so yeah, I think that's probably a pretty powerful thing. But you're right; the course is changing a little bit. The message is changing, and we're learning more. And so I'm really pleased about that.
Yeah, I a couple that I notice, and so I'll bounce them off you just to see how you react from a again from a function and physiology standpoint. I'd love to know your opinion. Um, and you kind of hinted at it just a second ago, actually, what brought it up, which was that I feel like one of the most overdiagnosed things in teachers of adolescent singers is the mutational chink, meaning that it does exist. There is a mutational chink, but if I can't get my 14-year-old singer to sing with a non-breathy tone, it does not mean she has one. There could be all kinds of other causes
Yeah.
that she's not doing something correctly. I feel like in the choir world we jump right to blaming that chink right away so that we don't have to like figure it out.
Well,
Uh, how do you feel about
I'm
that?
involved in a lot of. I'm very active on Facebook and a lot of our different groups that exist for singing teachers and choral directors, and those things come up from time to time. I'm very involved with young singers, and dealing with that sort of thing because I specialize in this muscle tension dysphonia diagnosis. And basically, I end up getting those young female singers, especially, who where the chink or the opening is where it's very obvious that it's much more of a than just a developmental issue. So when things get to more like the moderate level, it's one thing to just have a lighter voice with a little bit of breathiness in it that is more head voice predominant, and that's great. And I'm sure that person's going to work that out with a good voice teacher, right? But there are young girls, especially, where they aren't being given that one-on-one instruction because they're only getting group instruction, and they're so confused with all the different information that's coming to them. And to them, it's just this really, really separate thing. Chest voice is one thing, and head voice is this other thing, and they're so separate, and they cannot, for the life of them, figure out how to get them together. And so, the longer that goes on for a young singer, the more of a division that develops, and then the
Yeah,
vocal folds,
absolutely.
yeah, the vocal folds pull farther and farther apart. And is it a technical thing that can be overcome? Absolutely. But you'd probably be astounded to know how little studio voice teachers actually know about that. I'm not sure. That it's definitely an area that needs more. We need more education for teachers, choral directors, voice teachers, everyone about that. I don't think that NATS is going to happen. I'm sure you know what NATS is, our
Oh yeah.
National Association of Teachers of Singing, and I was so excited to. They have not made a call on the conference yet. It's supposed to take place in Knox at the end of June. But my paper and talk with a fellow colleague, a voice teacher colleague, was accepted for muscle tension dysphonia in the singer, and
Mm.
making an effort to educate. And that's not just young people; it's it's singers of all ages struggle with it. But you're right; I think that mutational chink gets highlighted a lot in
Yeah.
that age group.
Yeah, I think the reason I brought it up is I see in choir director discussion groups, I see very frequently the question of how do I, and I think it's a good question, what are some ways that I could get my choir of 60 freshman girls to sing with less of a breathy tone? And almost like clockwork, within the first 4 or 5 comments, you will see someone say, "Well, keep in mind, girls that age have a mutational chink." Which my concern with that response is that, yeah, in that group of 60, maybe one or two does, but the rest of them are probably just singing incorrectly. And so what I would prefer is that, obviously, with in trying to teach voice in the choral setting is tricky, because you're standing on the podium and you're hearing a conglomeration of what 60 kids are doing, and you might hear some predominantly incorrect things and you're responding to one kid, but then another kid who might have been doing it correctly starts adjusting what they were doing because they're all up in their head. It's just not a very good way to teach
I
teach
can't
voice. They've got yeah, they've got to hear what you're doing individually. But of course, for us choir teachers, that's hard. We don't have enough time in the day to figure all that out. I think where I have the problem with these myths and is that it's one thing to say, you know what, it's really hard for me to tell what they're doing wrong because there's so many in there and I just don't know. But we want an answer. Like we want an answer that's going to fix it.
Right. Well, and see, that's as I listen to you talk about that, Chris, the thing that comes to mind for me, and I had a workshop that was supposed to take place at NIU the weekend after the shutdown, the lockdown kind of happened with sheltering, and it was the first time that I've ever been asked to do this. A colleague there wants to really educate choral directors on this idea of efficient voice production and how these tools that we use in the speech pathology field and from the therapy world, how we can kind of pull that over into the choral warm up and setting things up a little bit different for our singers before rehearsal. And so that's what I think about. I think about, well, here's the thing, you may have those 60 voices that are all doing something different, but if you've got some techniques, some warm ups and exercises that get you a lot closer to a more uniformed alignment vocally for those students, those are great things to have in your warm ups regularly. And
Hmm.
and then I mean, it doesn't deal with that individual situation where you've got one or two singers that really need to figure that out, but you have a better chance at eliminating some of those issues when you're warming up strategically like that.
Yeah, absolutely, absolutely. What I've got one more to bounce off of you. What about the idea that singers who create who might be making a sound that is a result of not enough pharyngeal space, and that the solution for this is another one of those overdiagnosed things I notice. The solution for that is to simply raise the soft palate. Have you come across that one? It's
um,
probably the most popular choral myth that I know of. I just wanted to hear what your
yes,
physiological
I was just working with someone yesterday, and I'm trying to pull the session into my head, and I I asked her to. I work with the inverted megaphone shaping a lot in my work. The concept of the smaller, more narrow lips and rounding with the taller space in the back, and I've learned over the years which sounds and which exercises sort of make that happen for people. But I was working with a singer, and I asked for something or just tried to kind of cue her in a direction, and she said, "Oh, you just want me to lift my soft palate, right?" And I said, "Well, no, not necessarily." Because I think that's one of those things too that's kind of falling out of falling out of the norm in teaching,
I
because
wish.
because we're learning that sometimes shaping, like the natural tendencies that we have with different vowel shapes, and imagery and things, that it kind of takes care of itself. And so, you tell a singer to raise the soft palate, well, you don't know what they're going to do.
Hmm.
You, you have no control. You have no idea how they're interpreting that internally and what they're going to do. Now, have I said that to a singer before? Absolutely. But I find that over the years, I say it less and less in my teaching. I'm starting to not specifically direct singers to necessarily what I feel or what I think is happening, but more like guide them to their own sensations for that. And so I do think you're right. But there are other ways to get space. And if you tell someone to lift, well, you better have a good way of describing exactly what you want them to do to get that. And I think you're going to have better luck, uh, you know, cueing or facilitating like a certain shape, a certain sound that if they do this sound and shape their mouth this way, then that vocal tract. Because what we're trying to do is lengthen the vocal tract,
Yeah. Yep.
right? I mean, that's what we want. We want them to lengthen the vocal tract,
Yep.
and but it's really tricky, that interplay with resonance and space and shape. The interplay for every singer internally is so mysterious with that.
Well, yeah,
There's
and
no
I want you to correct my anatomy if it's wrong. But on that issue, it seems like when you're trying to expand the vocal tract in that way, that the body parts of all the body parts involved that could be manipulated, the soft palate might be the least of them. Meaning that it can move, but it can barely move, and a lot of times, at least the way I hear it, is that if there's not enough pharyngeal space, then it's oftentimes base of tongue tension that's causing that, or a poor laryngeal position, that's causing that. And the soft palate can move, but like if you look at it on one of those dissected head things that I'm talking about, where you can see
yeah,
the mouth move on the inside, it moves, but it moves like a millimeter. Whereas my
that's
tongue,
true. And I think a good way to think of it is that all of these parts and pieces of the system and of the vocal tract, and that concept of opening and closing and stretching and manipulating that, I want singers to feel like it's all very malleable. In any moment, uh, it all these parts are moving. And I use the concept of, when we talk about the tube, because I talk about a tube a lot, long, tall tube, and I talk about a slinky tube, like an accordion tube, because it constantly is moving as we make these different sounds and go through whatever lyrics with different vowels. And in terms of the soft palate, every singer is a little different in terms of what positioning they need that soft palate to be optimized from a resonant standpoint and a shaping and a tube standpoint. So I have some singers where I can tell that when everything is just aligned and perfect, they're getting a little bit more air through the nasal passage than the person before them. And and
okay.
and and there's some people say, well, you're not supposed to have nasal emission. Well, okay, but for this particular person, that soft palate position is what works best for them. And so I think it doesn't need to move a lot. Now, but what we want to avoid are extremes,
Right.
right? We want to avoid
Uh,
extremes. Too far, too low, too high. We need that sort of loose kind of position for that. So, and there are probably a lot of people that would challenge that understanding of it, but that's kind of how I think about it when I'm working with people.
yeah, well, definitely, I'm not going to challenge it. It seems like about you're confirming my priors a little bit there. That's kind of what I felt already. But I think this goes back to the thing I was saying before, where when we do try to get this information conveyed as choir directors to a large group of kids, I think that's where my bigger beef with using soft palate language a lot is in choir. Is you might be standing in front of a group of 60 or 50 kids, of which some of them are already, their soft palate is already in a really nice place. But because the overall sound of the choir isn't what you like, you start telling them to raise their soft palate, and then you've got a bunch of hyper extension going on from the kids who are already trying really hard, and oftentimes there are better singers
Right. Well,
And then,
and
well,
and from,
teacher says
you
raise
know,
my soft palate, so I'm going to start doing funny things.
right, I could, and I would say, like, this is an opportunity for me to tell you something from my perspective for all of these choral singers that are coming in to work with someone like myself. You give them that instruction, however you choose to say it, however you choose to cue them or guide them. And let me tell you that they believe you
Yep.
100%. They
Yep.
take what you said and what you told them to do because they have so much respect for you, and they believe they're hanging on every word and every instruction. And they're going to do it 125%. And
Hmm.
so, what I notice is that singers do so much. Like we think we have to do so much to get that sound that we're looking for, and the reality is we don't really have to do that much. So much of this stuff is just, it's innate, it's already built into the brain and to the body, and that the interaction between the all the systems that are involved in singing. And I spend, most of my time with singers, trying to get them to do less and take that away and
Hmm.
let the voice sort of freely and more naturally function. And so that's just a little insight, maybe from the perspective of someone who's, I always say I'm the person that helps clear the mud, because I come into these people's lives and they've got two choral directors and they've got a private voice teacher and they've got their mom who's also a singer, and they've got all these people and they respect them, but man, are they confused because they're getting so much different information. And so my job is to come in and kind of help them interpret all of that and say, well, when your teacher told you to raise your soft palate, let me tell you what I think they probably meant.
Yes.
And I don't take that job lightly. That is a tough job, because
Hmm.
sometimes I have to challenge things, and I have to do that very very carefully.
Yeah, absolutely. And I think um, as a voice teacher, one of the things that, because that's a small part of my life, I just teach a handful of kids individually. But as a voice teacher, it was one of the hardest things for me to shed earlier on in my teaching career, was to not, I'm not going to teach you how to resonate the way I resonate, because you hinted this earlier. Everybody's resonator is different. You mentioned when, like, a soft palate position might be one way for you to work, and not another way for me. And so I think that is part of the danger. And so that's why I try in my choirs to have most of that information come from their ears, asking them, do you hear that vowel that your neighbor is singing? Do you hear that resonance that your neighbor is singing, or do you not? If you don't, adjust until you do, rather than me saying, hey, raise your soft palate. Because, like you said, I don't know if what position that kid's soft palate's in anyway, because there's 50 other kids singing. So it starts to shift the burden onto them. I think that's probably healthier. And then if they have a voice teacher, their individual voice teacher can help them work out.
Right.
Mhm.
Exactly.
Yeah.
Exactly. I think I think that uh, I have been designing a model for registration balance in the singing voice over the last 2 years, and I'm just getting ready here in the next couple of months. I've been invited to present it at a big conference, and again, I don't know if this conference, it's a different conference. I don't know if it's going to happen, but it's been really fun to experiment with this model. It's sort of a comprehensive training model for registration balance, because that's something that I'm very passionate about in the singing voice, and singers finding that for themselves. Uh, but as a part of that, a part of this finding that balance, the shaping and the resonating and all that is a huge part of that. And that's the part of experimenting with voices that I enjoy the most. Is we try, and in therapy that's what we do. And as a therapist, as a voice therapist, I have to try to identify for every person, okay, when you do these two things this way, you get your very best product.
Mm.
And so we're going to start there, and then we're going to build your voice out from that. And that exploration of the resonance patterns and the shaping and the height and all of that, that's my favorite part of it. And singers and young singers especially, I think, should be encouraged to experiment with that. Not just,
Yeah.
I think so many singers get stuck in like one way of doing it. Like, this is the way I do it. This is how I make my voice, and I am not going outside of that.
Right.
I,
Absolutely. I couldn't agree more. And I feel like we choir teachers do it too. This was how I was taught to teach. And so this is how I will teach. So of course I'm always trying to, part of the purpose of this show that I do is to encourage people to analyze the potential problems that they might be creating by the way they do things. That's what our voice students have to do. They have to analyze, they have to come in and be told all the areas that they're causing themselves problems. And I think we teachers should do the same thing. So I really appreciate your help with this and your time today with this. And so let's,
it's been really, really fun to talk about
yeah,
it from a different perspective.
yeah, absolutely. And so why don't we wrap up this way? If there's anything that you, any advice or any bit of information that you would have loved to share with us that I didn't give you a chance to share with us, what would that be?
Yeah. Well, I would say that my greatest desire for people in your position, for teachers, for music educators, for choral directors, is that you all learn uh, to optimize and care and monitor your own instrument to the very best of your ability, and being open to that, being open to facing those signals and those challenges, and that you listen to those things, and that regular monitoring it is so valuable, because you can ward off all kinds of things by listening to those signals and resting and changing what you're doing, keeping your voice in shape. And then the final advice would be that when something changes, that it's okay to ask for help, and it's okay to get professional help. That there are people out there to help you with it. Voices aren't just gone. That it's absolutely possible to get them back and to work with them and resolve issues and explore and experiment. And there are people like me that want to help you with that. And
Yeah.
so we want you to do that. And so voice change that lasts longer than 2 to 3 weeks, that does not resolve, needs attention. And that sounds like a really short timeline, but that's kind of the golden rule for us.
Yeah, absolutely. Well, that's excellent advice, and I appreciate it. And I think the audience is going to find this to be a very interesting conversation. And what I'll do is I'll put your information in the show notes so that people can kind of see this information and see what it is that you do. And I'm excited for them to learn more about this topic. So thank you so much for coming on.
Yeah. And you know what? I want to mention to you also, and if you want to include this with the audience, that's great. I am offering a special right now for the rest of the month of April for singers and vocalists, for a really big discount rate for for a screening for voice
Mm,
problems, and it's a half-hour screening for $40. Which my normal screening rate, my normal evaluation rate is much higher than that. So that's a really great opportunity. And then and through that screening, you can find out if further evaluation is necessary based on what I'm hearing. And then I'm also offering something that I'm calling a vocal tune-up and conditioning session for 45 minutes for $60. And those are only available for the rest of April. So
yeah, and I would imagine you're able to do that because you're doing it online,
yeah,
and
I mean, and I can
you wouldn't even have
see,
to be in Chicago.
yeah, I can offer that service to anyone, anywhere, which is a unique opportunity for me right now. So
Right, absolutely. Well, that's awesome information, and definitely get that out there. Thank you for spending your lunch break with me.
yeah, thank you for having me, Chris. It's been a
All right,
pleasure.
thank you.
Bye bye.
Thank you so much, as always, for sticking around to the end of an episode. It's been a little while now since I've done a full-length interview episode, and I'm really excited to get back into it. As I mentioned to Lori during the conversation, it's been really tricky to come up with ideas for topics that are relevant to the situation. To be honest, it's been hard for me to just dive right back into, hey, how do we teach an A vowel or whatever when we don't even get to see kids? And so I'm going to continue to be creative over the course of the next month or so. For many of us, we don't come back to school till August. So I'm going to keep the shows coming out at you, but who knows what they're going to be about. I don't know. I've got some exciting guests coming up soon, which, of course, like I mentioned earlier, if you want to jump on the Patreon and have some advanced knowledge of that, just be aware that I am kind of rethinking for the next few months how I want to present the show. Not that it's going to stop being relevant to you, but in the hopes that it will stay relevant to you. During this time, I'm going to adjust as you're having to adjust, and I really appreciate you being a part of this conversation. Don't forget to like, subscribe, share episodes. These are all hugely helpful things. And head over to all of the sponsors' websites as you prepare for next year and use that Choralosophy promo code. That helps out big time and helps continue to further the mission of this show, to spread the word in as many ways as you possibly can. We want to bring a big tent to the Choralosophy podcast. Lots and lots of people with lots of perspectives for you to consider and for you to bounce your own ideas off of. As always, reach out at choralosophy@gmail.com or on the Choralosophers Facebook page if you'd like to respond to anything you heard on the show. See you next time.